Fantastic. Well, greetings, everyone. On behalf of the Christian Connections for International Health, welcome and thank you for joining our discussion today on global health financing, a changing landscape and new opportunities for local organizations. CCIH, Christian Connections for International Health, is an international network of approximately 140 Christian organizations and 20 partners, as well as 400 individual members. About 50% of CCIH organizational members are based in the US, and 50% are in other countries across the globe. CCIH's mission is to promote health and wholeness from a Christian perspective and provides opportunities for networking, sharing best practices, and advocacy. So let's get started. My name is Jenelle Williams, and I will serve as your moderator today. I am currently the Director of Programs for Global Health Action, an affiliate organization of CCIH. I also serve as the co-chair for the Health Systems Strengthening Working Group, CCIH. Jenelle, that's me. I am a global health, community development, and leadership and management strategist, and I've been working in the area for over 18 years, serving at the community, country, and global levels, empowering vulnerable populations to build healthier and more resilient communities. Currently, at Global Health Action, we as an organization engage with communities around the world to improve health and well-being of women, children, and adolescents through partnerships with government agencies, faith communities, and civil society organizations. Our programs strengthen community-centered health systems and build community capacity for addressing barriers to health since 1972. Our discussion today is on global health financing. And a few of the key objectives would be, one, to discuss what the changes are on the landscape and what that means for faith-based organizations working in global health. And secondly, how can faith-based organizations make the most of today's new opportunities to fund their programs and serve even more people? I'll proceed to introduce each speaker before they present, and we'll ask that we hold all questions until the end. Please use the comment box, which is in the upper right-hand corner of your screen, to ask questions. In order to input a question or comment, you'll need to use Google Chrome as your browser and be signed into a Google account. If you'd prefer to email your questions, please send it to webinar@ccih.org. And that again is webinar@ccih.org. Each of our speakers today, you will hear some remarks from them. And before we open it up to an interactive dialogue, please ensure to listen and remember that this webinar is being recorded. If you've registered for the webinar, you will receive a link from CCIH to this recording. If not, you can find it on the Christian Connections for International Health's YouTube channel and the CCIH website under Resources and Health System Strengthening. Without much further ado, let me introduce our first speaker, Dianna Lightfoot. Dianna Lightfoot serves as the advisor for the Bureau for Global Health at USAID. Dianna is a healthcare policy advisor and networking expert with national and international experience. Before joining USAID, she was director for Physicians Forum for Policy Analysis, a nationwide network of physicians who acted as advisors on healthcare policy-related issues. Dianna founded and was president of the National Physician Center from 2000 to 2011, a nonpartisan nonprofit organization formed to promote best practices in healthcare and education public policies. She has partnered with Chinese and African government leaders on multiple public health initiatives, inclusive of mental health, HIV/AIDS prevention. Dianna holds a master's degree in psychology and community relations and is a licensed counselor. Thank you so much for coming and joining us, Dianna. Would you kindly share your remarks with us today?
Oh, yes, thanks. I am so excited to be here. And I need to apologize to the field just briefly in advance for having a little raspy voice. But global health is actually, my job at Global Health is a dream come true for me. I love working here, especially in my role as working with faith and community-based organizations. I want to thank CCIH for the opportunity to discuss our mutual interest in humanitarian support for the world's most vulnerable populations, the ones you're out there working with. Since its inception in 1961, USAID has worked closely with faith and community-based organizations to increase the impact of foreign assistance. You are indispensable partners in our efforts to save lives, reduce poverty, strengthen communities, and assist people through humanitarian crises. Global Health is the bureau under USAID that includes maternal and child health and nutrition, infectious disease, the President's Initiative on Malaria, Population and Reproductive Health, the Office of HIV/AIDS, the Office of Health Systems, and the Center for Innovation and Impact. Each of these offices works with faith and community-based groups like yours. We recognize that the involvement of your groups like yours, have greatly reinforced our ability to support the health and well-being of many millions every year around the world. Therefore, at USAID, there's a growing focus on building those partnerships. USAID's administrator, Ambassador Mark Green, emphasizes that the goal of foreign assistance is to end the very need for its existence. So developing and deepening relationships with religious leaders in the faith community is part of Global Health's broader effort to promote sustainable development and assist countries on their individual journeys to self-reliance. Along with the administrator's support, in May of 2018, the White House issued an executive order adding increased focus and strength to USAID's partnerships with groups like yours, faith and community-based groups, especially with an emphasis on smaller and mid-sized groups who may have never worked with us. In USAID's current transformation effort, Ambassador Green has prioritized the reforms for our Center for Faith and Opportunity Initiatives. This center supports global health and all of our bureaus to achieve the following: to become a better bridge between faith and community-based organizations and the US government, to increase your capacity to better compete for funding opportunities, to eliminate barriers to partnerships with you, and to increase collaboration with you and those who work with you to address some of the greatest needs in the world today. A very big job for us all. With these goals in mind, Administrator Green recognizes the importance of growing these partnerships with you and faith and community groups. We understand also that identifying partnership opportunities and applying for funding can be a little intimidating, especially for smaller and indigenous groups. But these partnerships are being done successfully, and we want to continue to see them grow and stay successful. In Global Health's Office of Population and Reproductive Health, the Advancing Partners and Communities Project has worked with CCIH and the Ugandan Protestant Medical Board to support the role of religious leaders across multiple faiths as respected spokespersons to empower communities to be comfortable with promoting voluntary family planning. We know that the healthy timing and spacing of pregnancies helps save lives. Adding to that success, recently the Ugandan Protestant Medical Board won a subgrant through Advancing Partners and Communities to provide family planning education and services through faith and community-based programs. Also, in maternal and child health and nutrition, the Maternal and Child Survival Program has worked with many faith and community-based groups across 40 countries to build the capacity to assist in strengthening management and technical capacities, to some who are providing direct healthcare services to communities, and others serving as an important advisory, education, counseling role source for their community. The Maternal Child Survival Program was also able to help build the financing and management skills of the smaller organizations to qualify them to receive USAID funding. We encourage this type of mentoring and collaboration. In fact, it's essential. We want to build on these successes. More examples of global health's work can be found at our website. Because of these and similar efforts around the world, and because they are so critical to building capacity and sustainability, USAID is continuing to work on creative approaches for engaging new and non-traditional partners, which we realize can amplify and expand our impact. For example, we want to do a better job building those partnerships, especially among smaller and faith-based organizations, companies, and other nonprofits, with an emphasis on the indigenous. That means becoming easier to work with, less bureaucratic, and more user-friendly. And this is not just marketing. For example, we want to create meaningful incentives for our staff to conduct outreach, for new partners to give us a try, and for existing partners to expand their own subcontractor bases. Stay in touch, please, as we work to improve our processes. And believe me, we are working hard to do this. Also, since 75% of our workforce is overseas and 2/3 of our funding is in the field, an important place to begin is looking at our missions. USAID missions are in 80 countries, and we work in 100+ countries. The missions websites, and this is the link, will provide information on their current projects and priorities, and that will help you better match to your interest and your need. Also, you can get more information on how to partner by going to Identifying Partner Opportunities link, and also understanding types of awards. You're also welcome to reach out to us with any questions. We know that your organizations support health holistically, and we are very happy about that. That's so critical to sustainability. Building sustainable self-reliance takes time. That's just a fact. But there is no line of work in which that impact is more visible than in global health. This means that our efforts here at USAID Global Health will continue to focus on building capacity and commitment of government, and especially with the help of local and community-based partners, to meet the needs of each community, to prepare for both now and the unexpected. In summary, within the health sector, USAID Global Health aims to build capacity and reduce the disease burden, while strengthening health systems so that countries are able to plan, fund, and manage their own continued progress toward resilient health systems. The health of the world is all of our job. These investments pay dividends both now and in the future, as really we are working to work ourselves out of business. That's why understanding current trends in development finance and funding is so important. As you will hear from my colleague Priya, who will provide an overview of the current landscape for developing financing and what the future holds for global health financing.
Thank you so much, Dianna. What an oversight. What an incredible overview. Thank you for sharing all that USAID is doing, and especially around the areas of capacity building. As we move along, we want to thank Priya Sharma, and I will do a little introduction of Priya. Thank you so much for joining us today. Priya Sharma is a Senior Policy and Innovative Financing Advisor in USAID's Bureau for Global Health Center for Accelerating Innovation and Impact. In her current role, Priya uses innovative financing mechanisms and market shaping interventions to accelerate development, introduction, and access to life saving commodities, and leveraging private sector funding to achieve global health goals. Priya currently serves and manages USAID's first Global Health Development Impact Bond. She is currently leading work on the development of a blended finance roadmap that is designed to provide guidance to the Global Health Bureau and missions interested in using blended finance to implement health programs. Thank you so much, Priya. Welcome.
Thank you very much, Jenelle, for that introduction, and thank you, Dianna, for helping to set the stage. So I'm going to be a little fancy and difficult, and I'm going to try and share my screen. So give me 1 minute while I figure this out. Okay. All right, so hopefully everyone can see this, and Jenelle, if not, please give me a shout and let me know. Wonderful, so thank you. So 40 years ago, 3 out of every $4 coming from the US to developing countries was in the form of official development assistance, or what we call ODA. Oh, and now my slides are not working. There we go. Took a minute to catch up with me. Today, what we see is a very different picture. First, we see that funding for development has increased rapidly since the early 2000s. Second, we see that domestic public resources now account for the largest source of development finance. Third, private capital, both international and domestic, is becoming increasingly important. And finally, donor funding, which is that red line at the bottom, is making up a smaller share of total funding. And it's in this context that USAID and other donors need to rethink the role of traditional development assistance. Now, over that same period, trends in global health financing mirror those in the development finance landscape more broadly. Domestic government spending on health continues to grow, but varies widely by country. And private investment in health is growing, but remains selective. So if we double click on that red line, what we see is that funding for global health has increased exponentially, especially between the years of 2000 and 2010. And this is what's often referred to as the golden age of global health financing. But most recently, we see that development assistance for health, while still very high, has actually started to plateau. And if we compare the average annual growth rates between that golden age of global health financing between 2000 and 2010, we see that the average annual growth in development assistance for health was around 11.4%, but more recently is actually now less than 2%. And this is significant for a number of reasons. Firstly, we've made tremendous progress with the investments that we've made to date in global health. The fact that we can envision an AIDS-free generation or an end to preventable child mortality is a testament to that. But as a result of this recent plateauing in funding, we now have a significant funding gap. And if we as a global health community want to achieve our goals, such as those outlined in the SDGs, we need to figure out how to close that gap. So we look at the estimated funding gaps in the reproductive, maternal, newborn, and child health space. That's estimated to be around $33 billion between 2015 and 2030, and around $17 billion for that same time period in the spaces of HIV, TB, and malaria. So what does this all mean for USAID and for donors more generally? Well, it means that these trend lines illustrate what the current financing landscape looks like, and we want to achieve those goals that we've all signed on to. We need to move beyond the thinking that there are only 2 types of funding out there. Public resources coming from donors and governments that go towards generating social impact, and private capital, which is only used to achieve financial return. And recognize that today's development finance landscape is actually much more fluid and nuanced, and that there is a whole spectrum of capital that represents a diverse set of players with a range of social and financial objectives. So this means, in particular, that donors are changing the ways that they're using their funding. So this means that, in particular, we are looking at things like conditional funding tied to impact or results rather than paying for inputs. And I'll actually walk through an exciting example later in my presentation. And we're also trying to be much more catalytic with our resources as well. So using our public sector grant funding to leverage other donor funding or ideally private sector funding. And on the private sector side, we're also seeing some very exciting changes for USAID and for the global health space more broadly. We're seeing an increasing number of investors that are actually looking to invest their resources in opportunities that not only yield some level of financial return, but most importantly for us, have some level of impact. And I've simplified this for the purposes of this presentation, but we kind of can think of them in sort of two broad buckets. We have socially responsible investors and impact investors. And the main difference between the two is that socially responsible investors look for some kind of a filter when they make their investments, but they're still predominantly looking for a financial return. So investments in things like clean energy companies or not investing in tobacco companies is an example of socially responsible investing. Impact investing is much more purposeful. Impact investors actively seek out opportunities that yield social impact first, at the expense of a financial return. And it's this group of impact investors that USAID is particularly interested in engaging more purposefully with. Now, if we look at this whole spectrum of capital together, what this means is that there is a whole set of new players out there that USAID and other donors are trying to figure out how to work with. So we're looking for ways to kind of transact across this increasingly diverse financial landscape to mobilize additional resources for development and for global health in particular. Now, it's important to notice that these trends have been going on for a while, as you've seen from the chart, and that USAID has actively been kind of trying to adapt and react accordingly for some time now. And in particular, we have been focusing a lot on making increased investments in the area of domestic resource mobilization and private sector engagement. So one example of this work is the Sustainable Financing Initiative for HIV and AIDS. SFI, as we call it, is a multi-year initiative that seeks to mobilize domestic, public, and private resources to help countries control the HIV/AIDS epidemic. At the same time, USAID has also been applying a range of non-traditional tools and approaches to leverage additional sources of funding and to utilize our existing funding in more efficient or effective ways. And the two kind of primary ways in which we do this are our grand challenges for development, which are a kind of an open call to innovators to help us crowdsource for new and groundbreaking solutions. And in this example, we provide early stage seed or grant funding to allow these innovations to demonstrate proof of concept, with the aim of eventually catalyzing follow-on investment from private philanthropies or from the private sector. And then also our Development Credit Authority, or DCA, which is a highly effective tool that we've been using since around 1999 that has enabled us to unlock around $4.8 billion in private capital for development. So in health, a critical barrier that many private providers face in low and lower middle income countries is a lack of access to working capital. And without it, many providers cannot expand the types of services they provide, hire new staff, or maintain an adequate stock of commodities. The DCA can help address this issue by enabling commercial banks to extend loans to traditionally underserved sectors like health. And it does this by de-risking lending, by sharing the risk of default with the bank, reimbursing up to 50% of the value of the defaulted loan. And this sounds very risky, but I will actually note that across our entire DCA portfolio, which is all of the countries with that USAID works in, across all of the sectors that we work in, that includes global health, the entire default rate is less than 3%. So it actually shows that there is a lot of potential for private sector investment in sectors that we as a development agency consider important, but the private sector might be neglecting for some reason. So everything that I've just walked through is included in a report that we put out last year called Investing for Impact, and I'll share a link at the end of the slide deck, which is very much intended to be an educational resource that summarizes all of the trends that I talked about, but most importantly highlights 8 non-traditional tools and approaches that USAID is already using to help leverage private capital across that spectrum that I talked about earlier, and to help improve the efficiency and effectiveness of our resources. So the 8 that we highlight are the DCA guarantee, the debt swap, pooled investment funds, social insurance, seed funding and flexible grant capital, milestone-based payments, development impact bonds, and co-funding or GDAs. I'm not going to walk through each of these in detail here for the sake of time, but I do urge you to go to our website and to download the report, and I'm happy to answer questions later or take questions offline once you've had a chance to review the report. So for this presentation, as I mentioned earlier, I'm going to walk through one pay-for-results mechanism, which is the Development Impact Bond, which is something that you might have been hearing a lot about these days since it's generating a lot of buzz, and I know it's something that our administrator is also very excited about. So contrary to its name, Development Impact Bonds are actually not a bond. It's just a type of pay-for-results mechanism. And the main difference between a Development Impact Bond and more traditional pay-for-results that you all might be used to is that there's a private investor who provides upfront working capital to the program or the project implementer. And why this is important for you all in particular is that it actually allows smaller, more community-based organizations who might not have access to a ready set of their own working capital to engage in these types of projects because it solves that funding crunch that you all might feel. So in a traditional pay-for-results contract, a performance-based contract, if you don't have the working capital, you can't actually start implementing the project that you need to then get paid back for the outcomes that you're achieving. This solves that problem by having an upfront investor that provides you with that working capital that you need so you can actually start program implementation and then continue to get paid based on hitting performance-based outcomes or milestones. So the example that I'm going to walk through is a project that I manage that we're very excited about called the Utkrisht Development Impact Bond. Utkrisht in Hindi means excellence, and this impact bond is focused on improving maternal and newborn mortality in the state of Rajasthan in India. So India, as many of you know, has some of the highest newborn and maternal mortality rates in the world, and the state of Rajasthan in particular has some of the highest in India. And so what we wanted to do was work with the state government of Rajasthan to try and help them reduce those maternal and newborn mortality rates. And the way that we're doing this is by working to improve the quality of care that women receive when they go to deliver in a private health facility in the state of Rajasthan. So a very interesting little quirk about the health insurance scheme in Rajasthan is that public health facilities need to be accredited to achieve reimbursement from health insurance companies, but private health facilities do not. And so what we're doing is working with private facilities to help get them up to the same quality standards that public health facilities have to meet so that the quality of care that women receive will be on par with what they would get in the public sector. And so as you can see from this chart here, what we have is a partnership between a number of very exciting stakeholders. So our upfront investor is UBS Optimus Foundation, who provides PSI and HLF PPT, which is a local Indian NGO, with the working capital that they need to be able to identify private sector facilities who are interested in participating in this project, working with them to make the improvements that they need to then meet that sort of threshold of quality that we as a partnership have defined. And as I mentioned earlier, we're actually using public sector standards as that measure. Then we have Mathematica Policy Research, which some of you might be familiar with, who actually goes out and then verifies the results on behalf of the outcomes funders, which are Mark for Mothers and USAID. And so once Mathematica goes out and samples from the facilities that our two partners have been working with, that they provide a report to the two outcomes payers to say, yes, the partners did what they said they were going to do, or no. If the report comes back positive and PSI and HLF PPT have hit their targets and helped the facilities achieve that same level of quality that we see in the public sector, USAID and Mark from Others pay out a flat rate per facility that hits that quality target back out to UBS Optimus Foundation. If they don't, then USAID or neither USAID nor Mark from Others pays anything. So in that way, there is a little bit of that financial risk protection to USAID and Mark from Others in the event that this doesn't work. And Palladium there is kind of the overarching project manager. So they're responsible for the day-to-day coordination, since as you can see, this is something that actually has a lot of moving parts and a lot of partners and is a very exciting but new way for USAID to work. So I will stop there, and I'm happy to answer any questions about anything that I walked through. As I said, if you're interested in learning more about these trends and what we're doing in this space, we have this report, Investing for Impact, and the website is at the bottom of the slide. Thank you very much. And with that, if I can swing it in the most efficient way possible, I will turn it back to Jenelle.
All right. Well, welcome and thank you so much again, Priya. Again, that was so much information, but I think it's just the kind of information that is quite world changing. So thank you for all the work that you do, that you and Dianna do. And we look forward to chatting a little bit more during this session. I wanted to share with everyone that we will not have our third speaker today, and we do hope that we will be able to do that at some time in the future. Unfortunately, at the last minute, Nathan Millure, we were not able to have Nathan on the webinar today. With that said, there are a few questions that have popped up, and I'd love to begin to pose them to our speakers. The first is, PEPFAR has pledged to direct 80% of its resources, and I believe this might be for you, Dianna, but certainly to Priya. PEPFAR has pledged to direct 80% of its resources to Indigenous organizations in the next couple of years. How are you preparing these organizations to cope with the complexity of managing such grants?
Thank you so much, Jenelle, for that question. So unfortunately, neither Dianna nor I is working with the Office of HIV and AIDS or the PEPFAR team on this. So unfortunately, we're going to have to punt this question, but happy to follow up and get a response back to you.
But I will add something. Yes, but I will add something that this is an ambitious goal, but in large part, of course, it is to help focus on the Indigenous and faith-based and community groups to help build their capacity. This is not pulling off the Band-Aid. This is just an increased focus on the understanding that you're going to be there before, during, and after a crisis. And so we just want to really shine the light on that and help, shore that up and reinforce it.
Fantastic. Thank you so much, Dianna. And I think as a follow-up to that, I know at some point we were discussing the global financing facility and recognizing some of the changes in how funding and financing is being utilized and directed to a real more sort of capacity building for in-country support. Is there any way that you'd be able to speak to that a little bit?
Okay, yes, sorry, and we've been asked to turn our camera on, so hopefully everyone can see us. Yes, so sorry, Jenelle, you were asking about the GFF. Yeah, so this is very much an ambitious partnership, and I think what's very exciting about it is that it seeks to solve, I think, a number of challenges that have emerged over the last few decades in the development space, which is kind of divergent funding that's coming in for similar projects. So I think everybody on the webinar can be sympathetic to the fact that sometimes coordination is very challenging, and sometimes, unfortunately, despite best efforts, we do see duplication of effort and maybe a lack of alignment amongst donors, government, CSOs, FBOs, CBOs, all working kind of towards the same goals. And so what the GFF is trying to do is really kind of create that coordinating platform or that mechanism by which all of these different groups who are working in a particular country can come together and agree on a playbook. So everybody's working off of the same plan, which is a government-based plan based on their priorities in the RMN DAH plus N space, and kind of prioritize activities and resources based on their comparative advantages and their existing programming. So basically what it says is over the next 3 to 5 years, here's an investment case of all of the things that we as a partnership under the GFF are going to fund. And then it provides donors and country governments and local institutions the opportunity to say, okay, we think that, we should be funding this and you should be funding that. And in that way, then all of the things that need to be funded are funded. There's efficiency in the use of the existing resources. We avoid duplication and replication of effort. And we're actively all working towards the same goals, which are the government goals. What's also exciting about this and perhaps relevant on the non-traditional financing side is that there is a very strong emphasis on leveraging the private sector. So having the private sector be a voice at the table, and then also thinking about ways in which we can leverage the private sector, their funding and their resources and their expertise in support of these goals as well.
Fantastic. Thank you so much. There was another question that asked basically, is this call for partnerships with faith-based partners only applicable to US-based organizations, or are host country local faith-based organizations also eligible? And we all say yes, 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 especially yes.
There is an increased emphasis on Indigenous partnerships and mentoring and collaborative efforts. Actually, the one of the examples I used earlier was a great example of mentoring. And we encourage collaborative efforts. We encourage groups that are like-minded to come together and look for possible funding together. That increases capacity. It also makes it more, obviously, it's more scalable that way, or has the potential to be. There is no one size fits all here. We recognize that, but we absolutely are looking at building in country and supporting that with the recognition that we don't always need to be there. We won't always be there, but you will be.
Thank you so much, Dianna. And I think, that's the core of this. And I think that's it's a really significant shift. I mean, in the last, 30 years or so of just even development thinking. And I'd say there's a paradigm shift here. One of the things that you discussed, was a lot about this capacity building, and you kind of spoke about some of that example in terms of how USAID is looking at supporting and strengthening capacity building in country, or host country, and with civil society organizations and the like. And so I wanted to sort of connect both the the GFF and USAID, and sort of looking at those two, because there was one noted difference that I saw in, I think, a most recent application that they put out there, where there was an interest in providing support directly to civil society organizations. And then certainly that would include faith-based organizations in host countries to really look at that capacity building. How are they building community capacity and support for health priorities? And that was the first time I've really seen something like that. And then I think, Dianna, you were sharing a little bit more about an example of how organizations can work together to build capacity. Several of our members are faith-based networks, at the country level. And so you're speaking to that crowd. How best can they build themselves or position themselves strategically to really be the first go, or the first folks to have those conversations at the country level?
We've actually had some great examples of that just recently. As some of you in the field know, when you ask to meet with us and you need specifics, we are open and happy to do that. But of late, we've had visitors from a couple of different groups representing many sub-Saharan African and Caribbean countries. And it was fascinating, to your point, to listen to what each of them did, because all of them addressed something that touched on health. We're all patients at some point. But they also dealt with water and food security. They dealt with maternal and child health. They dealt with prevention, just the spectrum. So to sit there in the room with these faith and community-based leaders from all these countries and hear that they were in a network and they were in a region together, but they really had not been discussing how they could work together collaboratively. By the time we finished the discussion, they were talking about how they might work through one funding mechanism to address all of these holistically. So when we look at this holistically, we see the importance of collaboration when possible. We also don't like to see what one person does as redundant. We look at it as reinforcing. So though we may overlap on some issues, we are supporting and reinforcing each other. That really is the best example I can think of coming together holistically, discussing among yourselves where you have points and where you have issues that you can support and reinforce each other. And that is building capacity. And that is a kind of scaling up.
Fantastic. So someone just asked, the funding landscape changing for fragile contexts, where internal systems and capacities are not as strong? Yes, that's the question.
Yes, it's a good question, and I think that I don't think there's a good sort of yes or no answer to that. I think systems are changing, technology is changing. There's a lot of innovation out there that's actually, I think, allowing us to be a little bit more creative in terms of how we support and fund projects and fund health system strengthening at a basic level and support country governments as well in fragile contexts. And that is a priority of the administrator, actually, to do more and kind of strengthen our work in the fragile and humanitarian context as well. But you know, Jenelle, in your introduction, you mentioned that I was working on this blended finance roadmap. And actually, one of the countries that we were working on and very closely with our mission there is Liberia, which, you know, I think you could make a very strong case is a fragile country coming out of the Ebola epidemic and years of civil war. And it is very interesting to see that, you know, the mission there is very excited about engaging more in the private sector with NGOs, with FBOs and CSOs and CBOs, all of the large alphabet soup, and that there is also a lot of international private sector interest in working in these country contexts as well. And I mentioned innovation and technology because things like digital and mobile technology are making it easier to kind of surpass and circumvent maybe limitations that we might see in infrastructure or basic systems that exist there, and actually allow us to do some pretty innovative and creative things on the financing side. So it is changing, and I think it's exciting to see what we can do.
Yes, also what she said made me think. We were talking about how so much of our funding is in the field and so much of it is directed by the missions. But there's a misunderstanding, and I admit on my part before I became very familiar with USAID, that there's this big pot of money and we just write checks. But what we really do is we are from the American people, and we have finite resources. But obviously, with finite resources, we have to focus in areas where we will have the greatest impact. And this agency does an excellent job at doing the research and the missions and at focusing on where the need is greatest, and then trying to have the greatest impact through groups and organizations that address those needs. Very impressive, quite frankly.
And we are as well. I think everyone, without a doubt, can say that the support that USAID has provided on a number of levels is more than significant. I mean, I think when you look at the span of funders across the globe, where does USAID fit in terms of contribution to world health? It's incredible. I think the question next that we have is, and I think Priya, you shared that technology, both of you, mobile technology, how that is being used to mitigate those challenges of like infrastructural instability and, you know, things of that nature in fragile states, whether it's, you know, political or governmental instability or fragile states coming from environmental impacts. These become really important. How can small and mid-sized organizations that are operating in country that do not necessarily have the strength and the resources of a USAID from a global perspective, how can they have access to resources like that? So for example, we're not necessarily talking about the Red Crosses, right? So like I work in Haiti, we work in Haiti, we've been there for 36 years. And, you know, there's like ebbs and flows and you learn sort of how to work there. But for an organization that, like I said, could be small and may not have all of the capacities that a Red Cross or, you know, the actual USAID mission, where can they go to receive or benefit from the current resources that are out there for the innovation? And that was a roundabout question. I'm sorry.
I'm just thinking back to collaborative efforts. And since you mentioned Haiti, I think you did mention Haiti.
Yes.
I was actually in Haiti. And I was able to see what a Mission of Hope did through their network, coming together on both essentials and disaster preparedness and response. So there were very small groups. There were larger groups. There were developing groups, medical, water security, a lot that dealt with HIV/AIDS. And it was very impressive to see how when there was a central place they could go to reach out and get information and make that connection on something they may not have had the capacity to deal with, both staff and funding, but they knew where they could go. And that's why it's so essential to build networks in country, partnerships in country. If you are not familiar with the mission in your country, that is the place to start, because no one knows what we do better than the missions. They are our eyes and ears on the ground. So I would say start there and look at partnerships and collaboration and recognize the strength in networks cannot be understated. I know CCIH will agree with that.
Absolutely, absolutely. And thank you so much for sharing that. And so I think, for that larger audience, that component of how effectively do you use your network is, I think, where the nuts and bolts come and where that really meets, the rubber meets the road. So thank you for sharing that I think, one, it's important for folks to really connect with and know who their USAID in-country connects are and how to get access to them. And I think that might be something as a follow-up from this call, if folks are not already connected, to really start thinking about how to do that. And I think the other piece of this is really asking about, to what extent, is there mentoring capacity building for local FBOs and CBOs? So, and I guess kind of getting down to the nuts and bolts of this, someone who's in country right now, where are there opportunities, whether it's for funding or, to build and strengthen their capacity? They might have a network that's working in a local area within that country, or they might be connected to the larger regional network across the continent or region. So what would you suggest as where folks go to get this access point?
Well, I'm going to sound redundant, but I am so impressed with our missions. And there's a missions link on the site. And this is not punting here, because you are very welcome to get in touch with us with follow-up, and I promise it will happen. But that is, again, the heartbeat of the country. And on those sites, you can see where they're focusing, what their priorities are, and where the funding is most focused right now. If you also go to the Identifying Partnership Opportunities link, you can see the process of application. And quite frankly, it doesn't start at looking at the funding, the dollars. It starts at looking at the mission and then the process. So it's really not, I'm not oversimplifying. I think what I'm doing is telling you that after months of looking at this myself, because of how interested we are in building these partnerships, that is where I would start. And then the partnership funding link. And then if you have questions, you are welcome to come to us. But we are working very hard on fine-tuning our process, making the application process easier, and possibly even being able to help support some more technical assistance in the application process. We don't want this to be intimidating. We want this to be win-win. And I believe that is happening.
Okay. So sort of as a follow-up, and someone was asking for a little bit more clarity. Thank you, Dianna. So unsolicited proposals, but we're talking about RFPs. Where are we on that?
Yes, so unfortunately, USAID, it's very difficult for us to fund things that are unsolicited. So yes, keep an eye out. Dianna helpfully outlined the fedbiz.gov website, so keep your eyes peeled on that.
And grants.
And grants.gov, yes. But I will say we do have an exciting opportunity actually out through our Global Development Lab called Development Impact Ventures. DIV is the abbreviation, and I can share the website afterwards and can be passed out to the folks in the webinar. but they have a rolling call for applications and proposals. And so if you have a project or an idea or something that you're looking for USAID support, then I do encourage you to check out their website and throw in an application, because that is one way in which you can get funding for USAID that's sort of outside of our kind of large RFP mechanism.
I will add that I personally wish that we could fund every great idea that we see, because there are so many. But as Priya said, unsolicited proposals are very complicated because we have a tight framework. And also we have a mandate to make sure our resources are used correctly. So unless something is very unique and can't be duplicated anywhere else, they're generally encouraged to apply through the regular process that we've presented. Again, starting at the mission.
Thank you so much, Dianna and Priya. And we have another question, and I think this is going to begin to kind of, not necessarily close it out, but begin to sort of get into a little bit more meat. And we only have a few minutes left, but I think this is really going into Priya's presentation. Someone asked, they said, I think you said that in impact investing, investors expect social impact at the expense of returns. I believe many impact investors look for opportunities to have social impact and get good financial returns, believing that one can do good by doing well. Does the evidence really suggest that seeking social impact must result in reduced financial returns?
A good question. I think it depends on who you ask and what sector you're looking at. I think that there are certain sectors like the energy sector, infrastructure, agriculture, that lend themselves to being able to do good and make money off of that opportunity. In social, softer sectors like health and education, I think it's a lot harder. And I think the expectation that you will be able to do good and do well at the same time can actually sometimes do harm. That's my own personal opinion. I do think it is very much a balancing act, and it is important to recognize that, yes, you can do both. But if really you're looking to have that impact, that should be your focus first. A good example of this actually is our development impact bond. One of the big questions that we get is, the investor, well, it's UBS Optimist Foundation. It's not really true private sector. And my kind of feeling and my response to that is, yes, agreed. It is the foundation arm of the UBS Bank, which is a true commercial investor. But at the end of the day, we USAID have a development mandate, and we are first and foremost looking to improve health outcomes for poor women and children with this project. And, if we have a true private sector investor that's coming in and this project doesn't work, or, they're expecting returns that are just not possible for us as a development agency or out of sync with what we're able to do as a U.S. government entity, then, that's not the right partner for us. So part of it also is making sure that, we're finding the right partners that are aligned in terms of objectives and expectations. And so if that means that, that requires a partner that's looking for something that's below market or even just break even, then that's my preference, rather than somebody who's looking to do good and make a profit off of that. But like I said, it depends on who you ask and really what your definition is.
Thank you so much, Priya. And I think a follow-up to that is, you touched on it's important to understand objectives and expectations. And, I think, you've given us an example of how USAID, has a social impact endgame. And so, for an organization that is in country or a network that's regional of several smaller organizations, one of the potential opportunities for them to begin to think about health financing domestically is to consider using your model, right, of connecting with private partners, corporate partnerships, things of that nature. And so we have several examples of pharmaceutical companies, banks, and other medical technologies, so on and so forth. And so what guidance, what wisdom would you be able to give folks, or that you would Yeah, that you can offer to organizations that, yes, we can all look at USAID and say, hey, USAID, we are going to seek after funding from you. But I think the shift in this conversation, and really when you laid out the shift on the global landscape, is that public investment in health is shrinking, in the sense that it's no longer only public, or no longer necessarily going to be majority public funding. We're beginning to see more and more private investment. And so there is a shift, a paradigm shift in even how that's thought about. For smaller organizations that are just beginning to see this and just beginning to understand and probably feeling the changes, but not necessarily knowing that it came from these larger scale decisions. What wisdom, one, can you offer to smaller organizations to start working effectively in their communities, in their countries, with private sector, as well as at the regional levels, country levels?
I don't know if I would call it wisdom. We'll go with advice. How's that? Based on my own experience. I think one thing is, Jenelle, I think you described it correctly. There is a lot of interest, and it's coming from players and places that may be unexpected or maybe not, depending on your point of view. So it's unfortunate that Nathan is not here, but, pharmaceutical companies are, quickly becoming some of the largest investors in low and middle income countries. I mean, GSK has their Africa 2020 initiative, and they're pumping a lot of money into building basic health systems infrastructure in many countries that they have a presence in. Likewise, commercial banks are investing a lot. So there is a lot of opportunity there. I think just based on my own experience in terms of trying to put together these partnerships and find those right partners with aligned objectives, is really to, cast a wide net, be open to speaking to as many people as possible and hear what they have to say. But at the same time, don't be afraid to walk away from a partnership if it feels like the wrong one. You can go months, years, these things take time, but you can waste a lot of your own time, trying to make something work because on paper it seems like it should. You and, a company could have a lot in common in terms of larger, broader objectives. But when it comes to a specific project that you're trying to work on, if they're not aligned and you can't make it work, don't try to force something, because that can be a big time sink for a large agency like USAID, but especially for a small organization like the ones that are, that are part of CCIH. And so it's very important to just, I think, go into something with that in mind, in the back of your head. Really, is this the right partnership for me? Do I feel like I can make it work? And if not, don't be afraid to walk away. I think that's probably the best piece of advice that I can give.
And I'd like to add, something comes to mind speaking to the faith community. Sometimes you have not because you asked not. I have just witnessed a group out of Congo that was a small group doing great work with mobile health clinics and just trying to increase their capacity. And within a matter of 6 weeks, they had just reached out through a network, through a contact, and then another contact, and found business that was interested in helping support that, say the vehicle or medical supplies, and providing facilities. So right there, you have looked at building capacity and building reach that would not have been known had they not asked. Just get the word out. Sometimes it is that simple, especially for the smaller groups and the ones, as you said, are just starting. Ask, look, listen. You might be surprised how many people are looking for opportunities to give back to their communities or to give to the rest of the world.
That's right.
We see impressive numbers wanting to do that.
Fantastic.
Jenelle, can I cheat for a minute since I can see the questions that are coming in?
You can cheat.
I can't see.
So there is this one question around the changing landscape, including disaster relief. And I think that's a really timely one, since there actually is a lot of exciting work that's happening in that space. And I, the last minute, wanted to just kind of very quickly run through that. So the World Bank is doing a lot of work on pandemic preparedness, and they have their Pandemic Preparedness Fund. And there's a lot of work looking at catastrophic insurance and parametric triggers to actually be able to more quickly and in a much more, I think, timely manner, get funding out in the event of natural disasters. So this kind of started with drought relief in Africa, and there is a group that's looking at that. The acronym is ARC, and I can't off the top of my head remember what it stands for, but they're using that model to actually do something similar for pandemics, but then also natural disasters as well. And so that's a very exciting space to continue to watch. And actually, there's some work that some colleagues of mine are working on with the UN Special Envoy to Haiti, looking at innovative financing to help eliminate cholera in Haiti as well. And so, yes, this all does apply to disasters and disaster relief efforts as well. And it's a very exciting space. Thank you.
Awesome. That was great. That was great. And we're going to close out. We're at the 12 o'clock marker. And so there is one last statement that I'll make for everyone. Someone wanted to share that the Child Health Foundation has been giving very tiny startup grants in the amount of $5,000 to child health and water and sanitation improvements to local faith-based NGOs and collaborations that could scale up these pilots. So that's just an FYI. We wanted to thank everyone for attending this webinar. For those who will listen to this after, thank you so much, Dianna. Thank you so much, Priya. And of course, thank you to the Health System Strengthening Working Group, of which I'm a part. And if you're interested, please feel free to join us. We're going to continue having such powerful discussions and information sharing. Again, thank you, USAID. Thank you, CCIH. Thank you, attendees. Have a great one today. Bye-bye.
Thank you very much.